evening, everybody, and welcome to our weekly podcast, RAMP, Real Access Motivates Progress. We have an absolutely incredible show for you tonight, especially with the fear of everything of COVID going on. We have Dr. Philip Chan from the Rhode Island Department of Health with us tonight to answer all questions, COVID vaccines, rollouts, and everything we want to know. Thank you so much, Dr. Chan, for joining us tonight. This is such a much needed show, especially for the disability community. There are so many questions out there, and we'd love you to put our minds at ease. Please give us, though, a little bit of background about you and what actually your role is through all of this.
Yeah, Tina, first off, let me say thank you for having me. Thrilled to be here. Happy to answer any questions related to the COVID-19 vaccine and, frankly, anything else. So I'm an infectious disease doc. I've actually been here in the state for over a decade. I trained at Brown University, did my residency and fellowship in infectious disease. And I've been involved at the Department of Health for the last 5 or 6 years as one of their consultant medical directors. I've worked in their infectious diseases division. I've worked on things like viral hepatitis, HIV, STDs. And of course, when COVID hit, it was all hands on deck. So similar to many of my colleagues, I've been involved with this pandemic since the beginning. You know, we started meeting daily in January. So we've been meeting, now for over a year. So it's been a crazy ride, as everyone knows. I'd like to think we're in the fourth quarter of this pandemic, and we're almost there. I know vaccines, we're going to talk a little bit about vaccines today. Vaccines are here. It's exciting. It's what we've been waiting for. And hopefully, again, this is the beginning of the end. So very excited and happy to answer any questions.
Oh, thank you so much. Let's start with something easy about what the plan is current day today, because it seems to be changing quite often, frequently. What is the current rollout schedule at this point? And how many vaccines are we getting? Just kind of like give us an overview of that rollout at this point.
Yeah, it's a great point. One of the limiting factor of vaccine distribution in Rhode Island is just the supply that we're getting. Of course, we'd love to vaccinate everyone. We'd love to offer a vaccine to everyone. We're getting between 14 and 16,000 doses of vaccine per day. So not a whole lot, keeping in mind that Rhode Island, again, a state of about 1.1 million people, allows us to vaccinate a little bit over 1.5% of the population a week. So, it's just not a huge amount. We're currently still towards the end of our phase 1. So just to remind people, where we started, of course, was with healthcare workers. So we started with that because healthcare workers are among the most at risk. They're engaging with COVID patients day in and day out. And we need to protect our healthcare system. What I want to remind people, of course, is that when the healthcare system becomes overwhelmed, and by the way, we were pretty much there last month, this month, we were starting to open up, field hospitals, et cetera. When our hospital system becomes overwhelmed, people start to die more often with COVID-19 because they don't receive their adequate care. So we firmed up our healthcare system. We vaccinated, especially our hospital-based healthcare workers. We're working through our outpatient providers and other healthcare providers who work out in the community. We've also importantly vaccinated nursing home residents, right? And as people that live in assisted living, both staff and residents, we know that the older people are, the much more higher risk they are from dying of COVID. And we've vaccinated people in group homes and other congregate care settings. So we're working our way through. And what comes next, in a week or two, we're going to start vaccinating people who are 75 years of age and older and go from there.
That's great. That sounds wonderful. Now, somebody like my husband works for the healthcare system, but he delivers oxygen and hospital beds to people in homes and nursing homes and stuff. When does he fall on the list? I mean, he's, in his late 40s, but where would somebody like that, or the firefighters or the EMTs, where do they fall on the list?
Great question. So the other part of phase 1, there's a number of groups that were part of phase 1. And so I didn't list all of them, but certainly first responders, police, firefighters, EMS, pediatricians, people that are engaging with patients. Those are all people on the phase 1 list. So all those people should already have been vaccinated, which is great news. And then as we move forward into phase 2, when we start this age-based approach, meaning that we're starting with 75 and older. And then we're going to go down there through different age brackets every few weeks.
That's great. First question, major question is the vaccine safe? Should people with disabilities or any condition, underlying condition, should we be checking with our doctors? Because I know I have a slew of doctors because I have a bunch of different medical conditions. 4 out of 5 of my doctors told me not to get the vaccine. I'm still fighting COVID now. I'm still testing positive on day 23. So, we're still trying to get my regimen going. But let's find out how safe this vaccine is, and should anybody be cautious of not getting it, or should they talk to their doctor first? I know that's a lot of loaded question, but kind of all in the same gene pool.
Yeah, all great questions. So let's tackle that one at a time. So is the vaccine safe? So yes, the vaccine's safe. We've vaccinated now in Rhode Island over 100,000 people across the United States. Millions of people have been vaccinated. So we are starting to accumulate a wealth of experience with these vaccines. And I have to tell you, we haven't seen anything unusual. Meaning when people get these vaccines, what they feel is sore arm. A lot of times they may have some body aches. They may feel crummy, right? Something called malaise. And they may have some low-grade fevers. And that's a normal reaction. It shows that your body is making antibodies. It's doing what it should be in order to build up that immune response. The most serious thing that we've seen from these vaccines are allergies. So a severe allergy, a severe allergic reaction is known as anaphylaxis. We have seen that in a very small number of people. I'm aware of a couple in the state of Rhode Island, and there's been a number of reports now that have demonstrated that it's pretty uncommon, but it does happen. And so the only true reason why you should not get this vaccine is if you are allergic to a component of the vaccine or have had an allergy to the COVID vaccine. If you have allergies to something else, it's a consideration. You should talk to your provider. If you're pregnant, you can still get the vaccine. You should talk to your provider again. So there's really no other reason that you shouldn't get the vaccine. There's a couple of reasons to hold off. If you've had another vaccine within 14 days, it's recommended that you wait a little bit before you get the COVID vaccine. If you are COVID positive, it is recommended that you still get the vaccine, but you should wait until you no longer have active disease, meaning you should wait at least 10 days and all your symptoms resolve. And you generally shouldn't get the vaccine if you are in quarantine or have been in close contact with another individual with COVID-19. So those are some of the basic reasons. But I think, Tina, as you point out, if there's any question, please please check in with your doctor. I mean, the fact that you had 4 out of 5 doctors tell you you probably shouldn't get it. I mean, you probably shouldn't, depending on, of course, the reasons and whatnot. But obviously, if a provider is telling you to be careful, I would. And that's why we encourage you to talk to a doctor about this to get their 2 cents, because it's difficult for me sitting here or Department of Health to really know you. It's really your doctor knows you best, and they can help guide you to the right decision. And one last note on that, if I may, Tina. There's a lot of misinformation out there. This is the United States of America, right? No one's going to force you to get this vaccine, and everyone has their choice. But I just encourage people to really base their decisions on sort of the science and the facts and the evidence, and not to base it on rumors or myths that they may have heard.
Yeah, I totally agree with that one. I get emails all the time, or people questioning me because they know how connected I am, on the front lines, learning about this. Not everybody's not going to have a reaction. I mean, there's going to be that rare case. There's going to be that person with that special underlying condition that they didn't know about or they found out about later. But I definitely request everybody check with, and I mean, if you have a lot of underlying, you have more than one doctor. So if you don't like what one doctor said, check with a couple of them, check with a few. And that's what I did, because, I thought I was going to get the vaccine. And then after talking to 3 or 4 of them, because I have so much going on, I think they're concerned right now. Doesn't mean that later on they won't change their mind. But right now they're recommending not to. So, I mean, I'm home for the most part anyway, so it doesn't really make a difference to me. Mickey, are we still there?
Yep, totally agree. Yep,
So,
totally agree.
So the next thing that I have on the list is, what about somebody who may be like 75 or older, and they can't get out of their house. How would they get the vaccine? Like, is there some way that somebody could come to them, or could they do a drive-through, kind of like we had the vaccine, like especially somebody like me having mobility issues, or not a lot of places in Rhode Island are accessible. Is there going to be a drive-through option where we could stay in our car and get the vaccine? You know what I mean? So we're still not coming into contact with people, but we're able to get the vaccine.
Yeah, it's a great idea. In fact, I know some states that are doing that. So the answer is absolutely. It's all, all these ideas are on the table. We're still in the process of finalizing the exact logistics. I will say tomorrow there's a big press conference. Please stay tuned. But especially tomorrow at the press conference, we'll be releasing a lot of details about how people can get vaccinated. And I think, Tina, to your point, absolutely. People that are homebound, there are going to be options for them to get vaccinated at home. Obviously, not everyone has transportation. Not everyone can, walk up a set of stairs. So we're going to make sure that vaccine is accessible for all Rhode Islanders, and we're definitely taking into account just what you said.
Yeah, that's great, because I know that was one of the high questions that we have. One of the other questions I have is the law and the logistics to people with disabilities and a person that speaks for them. Like, I know personally one of my friends who has an older son. He's obviously older than 21, but he's still on the disability spectrum, and he's nonverbal. When he was in the hospital for a couple of days with COVID, she was not allowed to be by his side. And, she went through 2 days of complete stress, because here is her son in the hospital with COVID, nonverbal, and she wanted to be with him, and you're being told by one party that that's against the law, you have to be with them, and then not being actually allowed to be with him. What is your stance on that, or how can we make sure that that's taken care of?
Yeah, I mean, that's a problem. That's an example of one of the, 1,000 challenges that we faced during the pandemic. I mean, some of those rules were put in place, obviously, to protect people, especially people in hospitals where these hospitals are taking care of a large number of COVID patients. So, it's one of those no-win situations. My understanding is that the hospitals are allowing certainly a guardian at this point to be with certainly someone that may be disabled or someone that may not be able to provide consent. So I do think that problem has been solved, but it's something that we'll, continue to watch. It's a balance. Obviously, in that situation that you described, Tina, it would make complete sense to have someone who can be by the patient's side and help, a guardian, someone who can help provide communication as needed. So I think that makes sense.
Yeah. Is there a term, or is there somebody that they could speak to, like in a few hours of time of, their person being admitted, so we can circumvent that if they're still being dismissed and not being able to be in there with their significant other or child or whoever?
Yeah, each hospital, each clinic is so different. I know for the major hospital systems, they have patient advocates and they have risk management services. So I do encourage, if someone feels like they're being treated unfairly, you can try talking to the nurse manager in charge. That's usually someone that oversees, multiple floors. So that's a good person who usually has some decision-making power. And then, of course, there's always there's patient advocates, and there's other folks within hospital systems that look at these issues to make decisions about whether or not that they can be allowed. The system's not perfect. There are things that fall through the holes. I do know, having worked directly with all the hospital systems, is that they are trying to do their best. But please do bring things like this to the attention, both of us, the Department of Health, both to the leadership through some of these mechanisms that I mentioned. It is a way to bring these attentions to light. And again, it's difficult to make decisions. It's difficult when we make decisions. Sometimes there are unanticipated consequences, potentially like this, things that we can't always think about or account for. So again, we're trying to do our best. I know the hospital systems really are doing great and trying to do their best. And a lot of this we just have to tweak over time. And obviously, in the situation that you bring up, we need to address. So if people feel like, again, that they're not being heard, contact us, work with the hospital systems, and we can address.
And just a touch on that is, I know the hospital system is stretched and the people are exhausted and they're tired. I mean, they've been fighting this for, over a year now. And, instead of getting upset with them, approach them in the right way, because it's all in the presentation, and, voice your concerns calmly as much as possible. I know people are stressed during that time, but, bear with the fact that the hospital is trying to do their best and trying to make the best decisions, but speak up and make sure that your concerns are voiced. That's one of the most important things. The next item up we have is a friend of mine who is blind. That is her main disability. But she also has underlying asthma, and she was told that she can't get the early vaccination. She has to wait to her age group because she didn't have enough or the right underlying issue. And I thought asthma was on the list. So can you kind of go over, what qualifies you for the early underlying conditions for people to get that vaccine?
Yeah, Tina, this is a great question too. We have on our website and release guidance about what medical conditions will be eligible earlier in phase 2. Yep, you threw it right on the screen. Fantastic. So diabetes, lung disease, heart disease, kidney disease, weakened immune system. So the first thing I want to point out is that I think, as you're mentioning in this case, there is some gray area, and it's difficult for us at the Department of Health to micromanage and assess every single individual person that may sort of fall in some of these gray areas. So we really want to empower them and have empowered the medical community, doctors, physicians, other people, to determine who should get vaccinated. So I think if you look in this specific case, if you look at that category under lung disease, it says people with significantly reduced lung function. And so we're kind of leaving it to the medical community. For someone with a degree of asthma, obviously if they have severe asthma, they should probably be vaccinated. But if a physician determines that a patient has some significant asthma or degree decreased lung function, then that should be enough to get vaccinated. So we specifically didn't, it's so difficult to try to put restrictions on everything. So we're leaving it to the medical community to make some of these decisions and to act within the spirit that the guidance was released, and to make medical decisions based on their best ability to do so. So I would defer to the physicians in this case who assessed her.
Now, the physicians at the vaccination points, or your own personal physician? Who makes that determination?
It's going to be people who have their own personal physician. So we're going to release a little bit more guidance on this over the next couple of days, so stay tuned. But that's currently where we're headed.
Okay. And what documentation would somebody need to provide to get either an earlier age because of an underlying condition? Like, what documentation should they show up with to fill out the forms when they're going for their vaccination, to prove whether they deserve to get it or not earlier than this regular age group?
Yeah, we're still in the process of finalizing all those details, so stay tuned. There'll be more to come, probably tomorrow, if not, certainly by early next week.
Okay. So that kind of documentation, like, is there anything that somebody needs to prove earlier, or is it just a license, or is it just somebody's word?
So for the age cutoffs, obviously it will be a form of a driver's license, for example, right? Because it has your date of birth, so you can easily tell for that. What we're probably going to do for medical conditions is self-attestation, meaning people will be able to self-attest based on their doctor that they've had a certain medical condition. So, again, the goal of this is, look, we want every person in Rhode Island to get a vaccine. That's our goal. And so there needs to be some accountability. We need to have some trust. We need to trust each other. We do need to all do the right thing. But at the end of the day, we want everyone to get a vaccine, and we need to, we're asking people to do what's right, check in with their doctor. But we are probably going to make it simple and to make it logistically feasible to do this in a large scale way, which is our goal. Obviously, we're probably going to do allow people to self-attest to having certain medical conditions.
Okay. What are we doing about the mobility of, like, MTM or RIDE or to get the people to the actual vaccinations until you have more of a mobile drive-through or a home thing? Is there a way that people can call to get a ride to the vaccination? Are they all working at this point?
So we're going to have a call in. There's going to be a couple different ways to access vaccine. So there will, for people that don't have internet, there will be a call line that people can telephone in. Again, I think to your point, our earlier point about people who may be homebound, there's going to be mechanisms for them to get vaccinated as well. And we're also looking at drive-up options and some other options as well. So we want to make this as accessible as possible. We are looking at this through a lens of people that may have disabilities for one reason or the other. So we're going to do our best to accommodate everyone. I do want to, again, encourage people that there's always going to be situations that we don't quite think about because they may be less common and because this is a complex process. So bear with us. If you do see a situation where we can do better, please let us know. Please shoot me an email. Please shoot someone or a phone call. Again, we want to get this right. We want to we want everyone to have access to a vaccine, and it's going to take some time to get it right. We're going to do our best, but obviously it'll be a little bit of a work in progress.
That's fantastic. The next thing up is the special needs registry that we have here in Rhode Island. How are you going to use, because I've heard that the special needs registry is being used even currently. How is that being used, and how does somebody sign up for that to make sure that they're not missing out on, being notified if they don't have the web or if, they don't have email? I know the special needs registry works outside of all of that. So tell us how people sign up for that and what the benefit of them signing up for that would be.
Yeah, so thank you for bringing that up. Glad you brought it up. So obviously, as you're mentioning, being prepared is really important. And at the Rhode Island Department of Health, we have a registry that may be interesting to some people, some of your listeners. So this is the Rhode Island Special Needs Emergency Registry. So it's called RISNR. It lets police, fire, and other first responders in your community better prepare for you and respond to your needs during, historically during like a hurricane or a blizzard or some other emergency. It was really meant for weather emergencies. And as I think a lot of people know, there's a lot of people out there who may need extra help during an emergency, like winter storms, etc. And so the information submitted to the Rhode Island Special Needs Registry is shared with your local and state first responders, emergency management officials, people who have access. Again, it's confidential. It's only access to assist you. And it was used first this past weekend when we started to vaccinate people 75 years of age and older. A lot of cities and towns looked first through the special needs emergency registry to identify people who had special needs, people who were on oxygens or ventilators, people who had mobility needs, people who were visually impaired, blind, hard or deaf of hearing, hard of hearing. So I do encourage people, if they want to let the state know and the first responders out there know, please do consider enrolling. You can find a link off our Department of Health website.
And just to let everybody know, I just recently moved to Burrillville, Rhode Island. And one of the first thing I did when I was moving out to the boondocks and Snowmageddon out here, I went to my local fire department, the one that would come and pick me up if I had a medical emergency. And the first thing that they did was change my special needs registry to Burrillville, my new address, and they know. So if you don't have email or a way of linking onto the websites or whatever, just call your local fire department or have somebody go down to the local fire department and give your address. They can put you on the special needs registry as well. And they also know all my needs. They've actually checked on me twice because we got about 18 inches of snow out where I was. They actually came by and checked on me to make sure that I was okay because they know I'm home alone with COVID. So they actually came to check on me. So that's always another option if you do not have tech savvy people, because I know there's a lot of us out there.
Yeah, and that's a good point. And I do want to acknowledge our. Oh, I just wanted to acknowledge our first responders out there. They're, the first responder community in general, police, fire, EMS, obviously have really played a huge part in this pandemic. And I just want to acknowledge their work. They've, It's been great to see them involved at the town and city level, and I have a couple friends here in the town of Lincoln. It's been great the way the state has come together to address the pandemic. I'm proud to be part of our state response, and yeah, we're getting there. Sorry, go ahead, Tina.
I
Sorry
have to say, I mean, no, I'm sorry. It's like I said, there's nothing that's going to be perfect. This is due to all of us. You know what I mean? There's going to be downfalls, and there's going to be, like you said, situations that we don't know of or that come up that, is out of the norm. But I do believe that we're doing the best that we can, and we're working with what we have. But no one can fix a problem that they don't know about. So if there is a problem, voice it, whether it's to the Rhode Island Department of Health, whether it's to your local EMS, whether it's to your city or town. Make sure you're letting somebody know, because they can't fix a problem that they don't know about. You could always reach out to me. I have connections with the Rhode Island Department of Health, so I can forward it to the right department and help out as well. One of the other words that I've been hearing a lot about lately is code red during this pandemic. What is that, and why should we know it, and how does it affect us?
So there's I think you may be referring to the Red Bag Initiative, about having a red bag filled with various supplies.
No, that's our red bag from our organization. But somebody told me that if you're not on the special needs registry, that you can get notified by code red. Each city and town has this way of notifying people by code red, but I don't really know too much about it, and I haven't found much out about it, so I didn't know if you knew anything about that.
So it's a good question. So yes, so there is a statewide notification system. It's run by REMA to notify people. I actually don't know much more than that, but I know it does exist, and we can get more information for people that are interested about it.
Yeah, if you could definitely send me more information, because I haven't been able to really track down exactly what it is. But if it's a word that's going to be thrown out there and put in news articles and stuff, I think more people need to know about it and how exactly it affects people. So I think that's something that if you could look into and get that to me, would be great. And I would pass it out to as many viewers as I could possibly get out to. So thank you for being honest. I love the fact that when you don't know something, you just say you don't know it, and you'll find out, because so many people try to just fluff it off and, you know what I mean, not actually answer.
I will admit, I don't know much about the code red system.
One of the other things that is a big question that everyone's going is, how do we know how many vaccines that the state of Rhode Island is going to get? You talk to the business owners, and you talk to entrepreneurs and business, and they're like, how does Moderna or Pfizer not know in the next 90 days how many people that they're going to vaccines, and how many vaccines are going to go out, and whose states are going to get it? How does Rhode Island actually know how many vaccines we're going to get? And is that number going to go up? Or is it just something we're not telling the general public?
It's funny, Tina. I think you're touching on a theme of this pandemic, and that theme is, we don't know what's going to happen next. I mean, look, we've been told by the federal government, by others, a whole lot of things during this pandemic, and a lot of it you just never know until you have it in hand. And I remember a story about how we were promised some PPE. Obviously, there's been several shortages during this pandemic, from testing to PPE, personal protective equipment like masks and gloves. And I remember that we were actually sent an empty truck at one point that was supposed to be filled with PPE. So at the end of the day, we just don't know until we get it. There's been a lot of challenges. There's been a lot of, I feel like, false promises at times. And we just don't know. We don't know from one day to the other. That's why we at the state have really been flexible. I mean, I've really appreciated the governor's leadership. I've appreciated the director of the Department of Health, Dr. Alexandra Scott, her leadership, and really the whole state has come together to address this pandemic. Again, I'm really proud of that. But I think to your point, we have to have everyone, from us at the Department of Health, the state, down to everyone listening to this. We have to have a degree of flexibility and patience as we go through this pandemic. So we don't know from week to week exactly how much we're getting. Now, we've been told the numbers have changed over time. They changed for the better. We've gotten a little bit more, but in the beginning, it was actually a little bit less than we were expecting. So the bottom line is, we just don't know for sure. from day to day, from week to week, and certainly from month to month. Now, in terms of the vaccine, there's a lot of thought, there's a lot of news filtering down that it's only going to improve, that the manufacturing processes are getting better. That, we have the Johnson & Johnson vaccine, which should be reviewed by the FDA in the next week. So all signs are pointing very positively. We've also had a change in administration, who's looking, who's trying to be a little bit more transparent and communicate a little bit better. So I think we're all moving in the right direction. But again, just we at the Department of Health are having the same attitude, a little bit of flexibility, a little bit of patience, working with what we have, being innovative, and trying to get, of course, in the case of vaccines, just trying to get it out. So it's a great question. Hope that gives you an answer.
Yeah, no, I mean, it's absolutely answer. I mean, I don't like to get political because I think everybody tries to do their best with what they have. This is the pandemic that nobody was prepared for. Were there a lot of mistakes made? I would say yes, but can you really blame anybody? You know what I'm saying? Like, we're all floundering. But here's my question now is, what everybody has on their mind is, with the new administration coming in, do you feel that he has been chimed in and updated and on task, you know what I mean, to take over? Because I mean, she was just confirmed today, to leave us, so he's going to be taking over very quickly. But is he up to date? Like I said, whether you like him or not, approve of him or not, all I want to know is he informed? Is he in the meetings? Is he being updated? Is he on task? And does he feel the same way? Do you think there's going to be a lot of changes when McKee takes over?
Yeah, I've met McKee several times. I know that he's working with the Department of Health team and with others across state government to make this transition as smooth as possible. I know that he's formed, in fact, a COVID advisory group that will help, including experts, really, the current dean of the Brown University School of Public Health. So, I think we're in good hands. And I think we also have to remember, there's hundreds and hundreds of people across the state working on this effort. There's an entire infrastructure that's been built up over the past year, and that's not transitioning anywhere. So, the leadership is in place, and we look forward, obviously, to Governor McKee coming and working with the system to make things work. And I know that he obviously has the best interest of the state at heart. So, we're excited to have him come on board. We're obviously sad to lose Governor Raimondo. I really wish her the best of luck. She's been great during this whole thing, and obviously that was one reason why she was picked to be a cabinet member. But we will continue along. We still have the key infrastructure in place to address this, and none of that's going to change for sure.
And that's great. And I think that's going to put a lot of people at mind that we're not going to get worse. All we can do is get better at this point with the new governor coming in. I mean, I like Dan McKee personally because I've known him. I used to live in Lincoln. He lived in Cumberland. So, I know, and I think he's going to do a good job, but I think people were more worried that we were going to falter in between the transition. But if that's not the case, I think that puts a lot of people's minds at ease. To have a smooth transition, because I think that's so important right now. One of my next questions for you is, with COVID and everything, how they were saying that it was attacking certain communities, of color or poverty or differently. Is there going to be a better rollout for something like Central Falls or Providence or areas of Pawtucket and Woonsocket? Than there will be in other areas that it's not hitting as hard because of, where they live in the community?
Yeah, so it's a good question. So, one thing I've certainly learned during my years in public health is that there's a lot of diseases that disproportionately affect certain populations. And I guess, unfortunately, it wasn't surprising that we're seeing some of those same disparities during the pandemic. And I think, as you're pointing out, African American, Blacks, Hispanic, Latinos are just disproportionately affected by the pandemic. They have higher rates of infection. They have higher rates of ending up in the hospital. And unfortunately, they have higher rates of dying as well. So we want, in the state of Rhode Island, we made the decision, which I fully support and agree with, to bring equity to the situation in terms of vaccine distribution. So we have prioritized areas that are hardest hit geographical wise, by the pandemic. So that includes Central Falls, as you're alluding to. And specifically thinking about Central Falls, they've had, if you look at the positivity rate and the cases, if you adjust per population, I mean, Central Falls is like far and above beyond any other city or town in Rhode Island. It's really quite striking. And so it just made sense to start to offer them, folks in that community, vaccine first, because again, I want to remind people that we can't get a handle on this if there's going to be hot spots of outbreaks across the state as well. And so to achieve equity, to achieve equal access, and to also offer vaccine and get it out to folks and communities that are affected most, we did start offering vaccine to Central Falls specifically.
That's great. Thank you so much. I know that puts a lot of other people's minds at ease. Another big question that a lot of people are having is our home health care aides. I've known several in my community who live out and about. We don't live in group homes. We live in our own homes, or we live in our own apartments, that it's not overrun with, people of disability. But if somebody like me who has COVID, now I'm not getting somebody to come in, and not that I have it often, but because I'm COVID positive, they're not coming in to help me. How are they fitting into the rollout, and how can they kind of step up if they have somebody who's highly compromised, and they need to be taken care of, they need to be vaccinated?
Yeah, it's a good question. So I think that goes back to one of the initial questions too. So we're looking at options to vaccinate people who are homebound, who aren't able to get out, who may have other comorbid health conditions, as you are alluding to. So those are currently in the works. Again, we should have more information tomorrow or very shortly, but it's definitely on the list of things that we want to make sure are addressed.
All right. But I mean, I'm more alluding to the fact of like caregivers, like if somebody was a caregiver, like right now, my son is my caregiver right now because, but he's 20 and I'm highly immune compromised. If I didn't have COVID, how would he be able to get a shot to take care of me? Like family members who take care of somebody who's very high risk, how do they get on there without and skipping the age portion? Because not only is the person highly at risk, it's the caregiver that needs to be safer, because they're the ones going out shopping. They're the ones, tending to their every need, but they also have to interact with the patient that's highly immune compromised.
Yeah, it's a good point. I think, our priority is obviously going to be to vaccinate the patient that's immunocompromised. And by vaccinating that person, that should make that situation better. I think for the caregivers, they will be vaccinated based on age. The people that they're caring for should theoretically be vaccinated, so they should be protected. And I think there's just as you're alluding to, caregivers, people who are caring for people who are significantly at risk of COVID, probably just need to be a little bit more careful in terms of, don't hang out with other people in large groups, obviously, or put yourself in situations where you could become infected because someone else's life could be at risk. But again, we're working to address that situation by getting vaccine, obviously, to folks that are immunocompromised or may be severely debilitated.
And where do teachers fall in, with going back to in-person learning? Where do teachers fall in the vaccination schedule? Is it per age, or they have their own category?
So they're going to be vaccinated by age as well. This was a tough decision. I have kids myself, 9 and a 13-year-old. I actually currently live in the town of Lincoln, and I love teachers, right? And I've been to 3 decades of school myself as a physician, so I definitely appreciate teachers. And there's no easy way to do this, but if you look at the breakdown too, we definitely want to vaccinate teachers as quickly as possible, and we're going to do it based on age, as we are everyone else. And a significant number of them, upwards of 50%, will be vaccinated during the early phases, just based on age alone. So, I do want to thank teachers for their work. One reassuring thing, as someone that has sent my kids to in-person learning since the beginning, is that we aren't seeing a large degree, we aren't seeing even a moderate degree of transmission that's occurring in schools. So schools, K through 12 schools, have largely been a safe environment. They've done a phenomenal job looking at things like ventilation, physical distancing, masking. So it's a moving target, but at this point, we're still vaccinating teachers based on age.
Yeah, that's great. If there is a piece of information that you think should be out to the general public that you don't think is highly been recognized or out there to put people's mind at ease, what do you think that information would be? What do you think that the general public is missing and needs to know that they're really missing the point or they don't know about?
I want to encourage people that first off, the vaccines are safe. I have heard a lot of misinformation about the vaccines. I've heard that they cause people to be sterile. They do not. Just want to put that out there. They don't alter your DNA. They don't cause COVID itself. So there's a lot of information that I hope that people listening can look up reliable sources at the CDC, other sort of scientific-based information, articles, or of course our Department of Health website. But please don't pay attention to an ad on Facebook telling you, that this vaccine is going to put a microchip in you. That just doesn't make sense. The other two things that I just want to mention really quickly, especially for some of your listeners, are that we have a monoclonal antibody treatment that's now available. So this is the first approved treatment for people with mild COVID disease. So this is not meant for people in the hospital. It's meant for people in the community who have mild to moderate, who also have underlying health conditions. So people that are 65 and older, but also may have some of these underlying conditions that we've talked about. Those people should immediately talk to their physician or provider about potentially getting this monoclonal antibody treatment because it's effective the earlier you get. And that's what I really want to emphasize, and especially if you have mild disease. And that's something I feel like not everyone knows. And then I'm going to throw one more at you, Tina, if it's okay. There's lots of emerging evidence, too, about the type of mask that you use. So a lot of people are using cloth masks, and I want to encourage any masking. But there's a lot of data that's coming out that suggests that while cloth masks are good, other masks are going to be better. And this includes the surgical masks, the blue sort of multiple thin layer masks that are being used, as well as potentially N95 masks or KN95 masks. And what we've seen across the US and across the world is that masks and supplies are getting better and better. So just encouraging people maybe to up their game a little bit with masking, and also to be aware of this treatment out there, certainly if they have other medical conditions.
It's very interesting that you mentioned this treatment because my symptoms started on January 12th. I'm going to be very open about it. You know what I mean? I want to help other people. My symptoms became apparent on January 12th. My first trip to the hospital was on January 14th. My fever had spiked to 102, very, very congested, couldn't stop coughing and catch my breath. My pulse ox was only reading around 95. So, I mean, I wasn't under the 90 mark. And I got a x-ray saying pneumonia. I was never offered that treatment. Why do you think that would be? And I was sent home. I was released from the hospital that night with no medication. That night, they told me to go home and let it run through my system. And I was not offered that treatment. So what would prevent me by being released, number one? So I wasn't in the hospital. So I was in the very early stages, released back to my home and not offered that treatment. Is there something that I should have brought up? Is there something that I could have done differently to change that experience?
Yeah, so it's tough to know. Of course, you assuming depending on what hospital you went to, you were evaluated obviously by a licensed physician. And I will say this is one reason why I'm bringing it up. So back in January, not as many people were aware about it. It wasn't as commonly being used out there. It was in the process of ramping up here in the state of Rhode Island. So it sounds like it would have been a consideration for you, certainly if you weren't sick enough to be hospitalized. And that's one reason why I just want to bring it up now is obviously for people who may be in that position, who have COVID, have some symptoms, and it sounds like maybe you had moderate disease. That would be the situation that we want to think about, depending on all your other medical problems, et cetera, and exact symptoms, and of course the whole medical workup. But it sounds like that this is the sort of situation where monoclonal antibody treatment should be considered.
All right. Yeah, because I mean, I was back in the hospital 5 days later, spent the night in the hospital at that point, still not offered that, sent home with mild things. And like I said, right now I'm on day 23, still trying to find the right combination of medicines to take away most of my symptoms. The exhaustion is the worst. I am, for anybody who knows me for 5 seconds, I am like, go, 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 go. And I can't transfer it to my bathroom or to my couch without completely being exhausted. And that's still now down to day 23. But can you explain a little bit about what that treatment does so people can feel comfortable and confident to ask about it if they have to go to the hospital and they're being released and they're not offered it?
Yeah, I think an important point is that you want to get it ideally within the first 7 days, but certainly within the first 10 days of developing symptoms. So it sounds like with your second hospitalization, you were probably right on the cusp. And again, it's meant for people with mild to moderate disease. If you're hospitalized with COVID, it usually indicates more severe disease. And then we have other treatments. Usually we give a drug called remdesivir. Some people may have heard of that. Or we give dexamethasone. And those drugs have been studied and are shown to work in more severe disease for COVID-19. But again, this is one of the reasons why I'm bringing it up. So the way it works, monoclonal antibodies, as the name sort of implies, are antibodies, are preformed antibodies that you infuse into someone. And essentially, it's like an instant immune system. You're getting antibodies that start attacking the virus right then. So it's a way to sort of jumpstart your own immune system, give you these preformed antibodies, and to start fighting the virus before your body has a chance to develop their own antibodies.
That's great. So now people can ask for this, or they can at least mention it to the ER doctor or to their doctor if they do have mild conditions like I do. Because like I said, I wish I found out about it again too late. I mentioned it at my second hospitalization, and you were right. At that point, I was too far along, so I wasn't a candidate. But I wish I knew about it earlier to give that a shot. You know what I mean? If it could have helped.
Yeah, and I think, Tina, you raised an important point earlier on, which is the concept of advocating for yourself. And I do think that's important, certainly for patients. And I mean, that's why I love to do what I do, is I love to empower people with knowledge and education. And so absolutely advocate, bring it up. You have to have a doctor who knows about it and is informed. But I want to assure people that it is a proven treatment for COVID, mild to moderate disease. And we've worked with the provider community to increase knowledge and increase access. And there are mechanisms out there, including on our website, where people should be able to refer patients to for this treatment if needed.
Yeah. A question I've received later is, if you get that treatment, are you still eligible for the vaccine? Like, do they offset each other, or it's not a vaccine? It's a treatment. That's what I want to explain to people, that it's not a vaccine, it's a treatment. Or am I incorrect saying that? Because some people told me that if you got that, you wouldn't be eligible for a vaccine later. And I don't know if that's true or not.
So it's a good question. We do worry that the monoclonal antibody treatment will interfere with a vaccine if given. So the current recommendations are to let that treatment be excreted from your body. And so it's recommended actually not to get the vaccine 90 days after you receive the monoclonal antibody treatment. So 3 months. So it's a bit of time after to make sure it's all flushed out of your system. So people would have to wait. And I guess that is a consideration.
Yeah, that like I said, that's great knowledge. Because like I said, when I heard that, I wasn't sure, because I'm like, they're calling one a treatment and one a vaccine. How can you have one without the other eventually? Now, somebody like me who's on day 23, obviously I still have symptoms. I'm very short of breath. Sometimes you can hear it while I'm trying to talk right now. How long for somebody like me, if I could get the vaccine, where should I wait, or where should I fall in? Like, should I wait till I test negative? Should I, it's 23 days. Am I negative? I'm going for another test tomorrow to find out. But for the normal person, what is their steps that they should take if they were somebody like me?
Yeah, great question. So Again, I would look at, we're prioritizing based on age and medical conditions. And so I would ask you all those questions, which you don't have to answer. I'm not asking you them now, but, I'd want to
Yeah.
take a full history, your age, your medical conditions. In terms of when to vaccinate you now that you have COVID and still have some symptoms, it's recommended once you are essentially your active infection has resolved. So that's at least 10 days. And we generally want to see you without fevers for, at least a day, if not more, and certainly a reduction in your symptoms. So there's also the thought that when you have disease, is that you can wait for up to 90 days if you want before you get the vaccine. So my recommendation to you would be to wait until you feel a little bit better, and it could be a few days, it could be a couple weeks, it could be a couple months. But I would wait, and I would be reassured. I think in your situation, Tina, that sounds like you were quite sick, and I'm glad you're better. But that also means that you had a good dose of that virus, and so your body, just by your symptoms, the fevers, the chills, everything else, your body had an immune response, and so you likely have a pretty good pretty good antibody response to that virus. So I would be less concerned in you. I would wait until you feel good, and that will depend on how you feel.
Right.
In someone that has mild disease, or if you are asymptomatic, or if you had very mild symptoms, and certainly if you're asymptomatic, I would recommend not waiting. I would say get it right after that 10-day mark, because people that are asymptomatic, I worry that they may not have had that robust immune response. But in someone like you that may have had more significant symptoms, I'm a little bit more reassured.
Yeah. Now, the biggest question that most people have is, can I get this virus again? Once I finally get better, can I get it again? And will it be as bad, or should I still be as cautious? That's a big concern, especially the people who are asymptomatic that tested positive. Can they get that virus again? Can they continue to spread that virus onto other people? Or is it like the chickenpox? You have it, you had it, you're done. You know what I mean?
Yeah, it's a good question. I think it's going to be a little bit different for everyone. We definitely know that people can be reinfected with the virus if they've already had it. And there's at least one report out there that I'm aware of. Actually, I was just reviewing it today, of folks someone who was infected and their second infection was worse than the first. So we think it can happen. We're a little bit more concerned about it now that there's a lot of increasing attention, as everyone knows, on these variant COVID strains. So people need to be careful, I think, until more of the population is vaccinated, until we've achieved some degree of herd immunity and the case rates in the community come down. So that's why we still have some of these restrictions in place from a state level. That's why you'll hear people like Dr. Fauci on the news from the Fed saying to still be careful. We still need to be careful. But we're getting there, and I'm reassured again that more and more people are being vaccinated every day. So we still have a little bit of ways to go, but again, hopefully by summer, for sure, we can have some degree of getting back to normal. I'm going to be optimistic.
Oh, perfect. I'm going to be optimistic with you because I need my summer. But we're going to put up a slide of, places that people can go to do their research. But give us the most trusted places that that people can go to get the right information and not believe the tabloids or not believe the rumors.
Yeah, so if you want to focus on sort of public health sources, the CDC, trusted. I definitely trust them. The Department of Health here, the Department of Health, everything is vetted. It goes through physicians, other public health experts, the World Health Organization, the WHO, WHO, and then, trusted news sources. There's a number of general media sources that I think have done a really good job. To tell you the truth, the New York Times comes to mind. New York Times. I mean, I've read a lot of really well done, scientifically based articles on some of these more major media sources. So, New York Times, other, Washington Post. I've seen some good stuff, et cetera. But if people want some really scientific public health based, put a CDC in the search line. CDC, should I mask? What type of mask? CDC. And you'll get a lot of good information from that. If you are one of those science dorks like me, I'm a physician. How can I not? You can look at the scientific journals. So if you want to, go to some of the repositories and Google Scholar, if you will, you can look up actual journal articles that will get to the evidence and the science behind a lot of what we do. So that's another source too, if people want the raw data.
That's great. Thank you so much. As we're nearing the end of our hour together, what is the most important thing out of this podcast that you want people to take away from this? What words do you want to leave with all of our Rhode Islanders and beyond? Because we're a national organization, so you're seeing all over the country right now. But what are the words that you want to leave with everybody? What's the most important message you want to get across?
Yeah, I think one of the more distressing things to me lately in general has been this the way that politics and misinformation and science has intersected. And I just want to encourage people to really focus on the science and the evidence and public health experts. And I'm going to admit, I'll be the first one to admit that we don't have all the right answers, but we're trying to get to the right answers and the right place. And our goal, certainly at the Rhode Island Department of Health and other public health departments, we have the good of the public in mind. So we're doing our best. We're trying to get people vaccinated. We're releasing evidence-based recommendations like wear a mask, physically distance, restrict, social gatherings, etc. So I just encourage people to make decisions and to focus a little more on the science and the evidence and facts. Things like, should I wear a mask? It's against my personal freedom. A little bit discouraging me, to tell you the truth, because we're all in this together. I'm 42 years of age. I have no medical problems. I run every day. I wear a mask. I physically distance, and I don't do it necessarily to protect me. I'm doing it to protect those around me. I'm doing it to protect my parents, who are definitely higher risk. I'm doing it to protect the greater Rhode Island community. So just asking people to work together. Again, I'm very proud to be part of our community here in Rhode Island. I think Rhode Islanders in general are doing a fantastic job, but encouraging people just a little bit more patience as we work our way through this. We're all in this together, and we are getting there. And I am really optimistic with these vaccines. It's been a long year for all of us, but I do believe that we're getting there.
I do too. And I agree with you. I'm proud of Rhode Island. I'm proud of, the state that we live in, and we are stronger together. And the best information I can give everybody is to advocate for themselves. If you don't think something's right, or you think there's a better way out there, advocate for yourself. Keep calling politely, respectfully, have patience, but keep calling until you feel comfortable and you feel confident in your gut that you're getting the right information. And I also am honored for the fact that you know about our Red Bag initiative, about carrying all of your medical information on you at all times that's non-tech based. So during a pandemic like this, everybody should be going to www.rampisinclusion.com and grabbing a red bag for you or your family members today. Whether you have a disability or not, it is a great opportunity, and it works for everybody. Just if you wanted to be an organ donor or have a DNR, this takes out all of the HIPAA laws because it's all written down for you, for the medical team and your doctors to know, and nobody else. So it keeps your information personal. But thank you so much, Dr. Chan, for joining us tonight. You have answered so many questions, and I truly believe you put a lot of minds at ease tonight. But like you said, make sure you're doing your research, believe the science. It is not political. I don't care what side of the aisle that you're on. Having COVID myself, it is not the flu. It is not pneumonia. It is something completely that I have never experienced in my life. And I've gone through cancer 4 times, paralyzation, and everything else. And this is something that was completely not normal at all. And new symptoms every day, crazy symptoms that all kind of like rolled in the ball. So like you said, do the research. But thank you so much. I am so honored to be able to interview you tonight and have this information. If anybody reaches out to me, I will definitely be forwarding you the emails to get further questions answered. And I'd love to do a follow-up with you in a couple of months and see where we're at that point. To kind of make sure everybody stays on the same page. But thank you so much. I really appreciate this, and all of my guests really appreciate this. So thank you.
You're welcome. Thank you for having me, and thank you for your work too. Thank you for spreading the knowledge and education and awareness. Thank you.
Great. Have a great night. See everybody